Professor Dr. Sampoornam from Annai JKK Sampoorani Ammal College of Nursing, Namakkal, India. So I'm a psychiatric professor for the past 13 years, and of course I'm a psychologist also. I've taken up master's degree in psychology and one more master degree in counseling and psychotherapy, and doctorate in nursing, psychiatry nursing I've taken up. And I love suicide counseling, and my research area of interest is breast cancer, psycho-oncology, and suicidal clients. So I published 93 papers nationally and internationally, and of course I'm writing a book also in research. Probably like a couple of months I may publish it. Of course, I've been moderator for many uh, national international journals. I've presented many papers in national international journals. I mean conferences, and I'm guiding PhD scholars also. It's a very short introduction about me. So here, it's a very good topic. Today I'm here to talk about nanopsychiatry. So from listeners or participant or delegate may know, many of you from the Department of Mental Health or even from psychology, many participant here, you can just raise your hand, you can say hi to me at least. Okay, fine. Let me continue. So here, Kirtana Umapati. It's fine. So it will be little useful for you, I suppose, Kirtana. So here, nanopsychiatry. It has just evolved for the past 7 to 8 years. So this nanopsychiatry is totally different. And see, for psychiatric patients, we put drug, we put antipsychotics, we put antidepressants, anti-anxiety, even mood stabilizers. We all put all these drugs for the psychiatric clients, and uh, all the drugs, we observe experimental symptoms and we put patients again in trouble. And of course, it is very difficult to treat them again and again. It's a long hydrogenic emergency. So to put a full area called nanopsychiatry, so this 9-time small particle. So this 9-time small particle can just injected, or it is just made to swallow by the patients. So automatically this 9-time small particle can even cross the blood-brain barrier. That's an important point to note here. It crosses the blood-brain barrier and it hits the biochemical, it neutralizes the biochemical changes. So very nutshell introduction about nanopsychiatry. Next slide, sir. Yeah. So nanomedicine is defined as the area using nanotechnology concepts for the benefit of human being health and well-being. The use of nanotechnology in the development of new drugs has had in the last years a widespread presence in the explained about psychotropic drugs in the field of psychiatry. So this pharmaceutical, in not only in pharmaceutical industry, this nanotechnology has been used in medical field simply called as nanobots. So I think you would have heard about nanobots. So these nanobots are excellent to treat even cancer patients. Cancer cells are destroyed by nanobots or nanotechnology. Of course, in certain areas, they use as water purifier. They purify water with the help of nanotechnology. There are so many newer trends in nanotechnology, and especially in nanomedicine, it treats all many illnesses. Like it could be like physical illness or mental illness. Especially, it is useful. It is much useful in even in the field of psychiatry. Next slide, sir. Yeah. Nanomedicine research has expanded greatly in the last decade, like 10 years. So, however, very little data concerning research and development in psychiatry or mental health has yet been published. The field of nanopsychiatry will emerge along with alternative interventions for depression and gene therapy for depression. See, from long back, even like past decades and all, they're not much familiar with gene which is real responsible for causing depression. But at present, they could say that many gene therapists and gene researchers, they could say that it is only because of NKPD1 gene which is purely responsible for depression. So at present, what do? They change the protein code of that particular gene, NKPD1 gene. They change the protein code, and automatically this depression will not be transferred from generation to generation, because you all know that mental illness is purely a hereditary disorder, so it cannot be transferred from generation to generation. It blocks. So this type of gene therapy is highly available, and with nanopsychiatry they are successfully treat patients, depressive patients under gene therapy. Next slide, sir. So this nanopsychiatry is a novel term that is used to emphasize the importance of combining the psychiatry with nanomedicine. So nanoparticles are prepared with organic polymers. They are simply polymers which are organic, of course, inorganic elements also available. All are polymers here. Next slide. So application of nanomaterials as drug carriers in psychiatry has potentially numerous advantages, primarily in terms of increased therapeutic efficacy of the medicament and reduction of toxicity. See, I just now explained. So this all antipsychotics could cause EPS, but this nanotechnology, it is not that too, what to say, it doesn't cause that too side effects for the clients. It is available in injection form. We inject, nanoparticles, they inject, most of the researchers, they inject, and a few nanoparticles are given orally for the patients. Next slide, sir. Several research efforts have already been focused uh, on the synthesis of antipsychotic and antidepressant nano-based drug delivery system. Many of these nanoparticle systems have been successfully tested both in vitro conditions and on animal experimental models also. They have tested successfully. And you should know here about not only nanoparticles, and I'm here to talk about even digital pills. So before the rise of nanotechnology, and even the after the rise of nanotechnology, many scientists, they had intellectual conflict why to switch on with digital pills. So I think you would have come across the term digital pill. So digital pill is nothing but a sensor. A sensor will be placed inside the tablet or the medicine, and the sensor will have two coatings, outer coating called copper and magnesium coating. So when a person takes antipsychotic, third generation antipsychotic orally, that particular digital pill orally, what happens? The copper and magnesium dissolves in the intestine. Of course, all the medicine gets absorbed, and it is metabolized, and it is again distributed equally, absorbed and everything as such like normal drug. And finally the sensor will be expelled in the feces the next morning. And in the meanwhile, whenever the patient takes the digital pill, immediately the patient, of course, nurses and healthcare professionals, they receive message in their smartphones. So at what time, in what area, in what in which part he has taken that particular drug, whether it has acted or not, everything it is again tracked. We can track the patient with the help of digital pills again. So one more new technology. So you should know something here. This nanotechnology and the smart pills are running very parallel. It's like a parallel part, and most of the scientists, they prefer nanotechnology or nanopsychiatry. Some scientists, they talk about digital pill, Both are like balanced state. Next slide. Nanoparticle size approximately between 1 to 100 nanometers, have in some circumstances, and the ability to pass through blood particles can pass through blood-brain barrier. Researchers have suggested that nanoparticles could be used in various psychiatric diseases. Next slide, sir. Like many diseases like schizophrenia, endogenous depression, bipolar disorder, and even most of the disorders today are treated with antipsychotics and antidepressant medicines, so potentially a candidate for nanotherapy. Yes, all schizophrenia, even depression, BPAD are treated successfully with the help of nanoparticles or nano psychiatry or nanotechnology, or even in the pharmaceutical industry, psychopharmaceutical industry. Next slide. Next slide. So among nanomedicine, nanopsychiatry specifically deals with the potential role of nanotechnology in solving psychiatric diseases and problems. So with this, my speech is again getting over. Any questions can be clarified right now. Thank you. Thank you for patience listening.